Hey everyone, welcome back to my channel. Kelly here, cancer rehab and lymphedema physical therapist. There are a lot of different claims and controversies out there on the internet as well as with other healthcare professionals about lymphedema and breast cancer. In this video, I'm going to talk about 3 different statements or myths that exist about lymphedema and breast cancer, and we're going to talk about what is true and what is not. This video is part of a series of videos, so if you want to see the other ones, you can check out the playlist up above, and be sure to subscribe down below to see more videos like this. You can also follow along with us on Instagram for more related content on cancer rehab and lymphedema. If you have any other myths or statements that you want to hear more about, you can also comment those down below for future videos. So the first myth or question we're going to talk about is, does getting a manicure or gardening increase someone's risk of developing lymphedema? Now, I spoke a little bit about this in the first video when discussing blood draws and lymphedema, which I'll link up above. But in general, when talking about recommendations of what things to avoid to decrease your risk of lymphedema, a lot of times they're not explained very well. I think as a health professional, if we're going to tell someone or recommend not to do this or not to do that, we need to explain why we're saying that. Because a lot of times we're adding fuel to the fire or adding more anxiety to something that is heightened. So no, there are no research studies that say getting a manicure causes lymphedema or gardening causes lymphedema. What it really is that there is an increased infection risk with those. And what we do know is that infections and cellulitis do increase someone's risk of developing lymphedema if they've had lymph nodes removed. And so when we think about these recommendations, we really want to look at the picture of infection risk. How many times have you gotten cut in your lifetime and have had an infection from it? For most people, it's probably none, maybe 1 or 2 for another person. And so anytime we go and we get our nails done or cut and they cut too close to the skin or the cuticles are cut and it opens up the skin, yes, someone's at a higher risk for infection at that time. If someone's in the garden and they get scratched or cut on the thorns, same thing. Anytime you have that opening, there's an increased risk for infection. A lot of times the body takes care of this and heals it, but we do want to watch it closely. So cleaning it really well, putting some sort of antibiotic ointment or cream on it, and watching for any infection signs is what we want to do. By lowering our risk of getting infection, we can lower our risk of developing lymphedema. So overall, the answer is no, they do not cause lymphedema, but what can we do to lower someone's risk? And so if we're thinking about manicures, go to a place that you trust, make sure that you encourage them not to cut anything too short. When it comes to gardening, try to wear some sort of gloves or some sort of protection to avoid or minimize as many cuts or scratches as possible. Those are the things that we want to talk about. Again, I think it's really important to understand the context of why these things are being recommended. So the next myth or question we're going to talk about is, if someone's only had 2 lymph nodes removed, are they no longer at risk of developing lymphedema? If you've had any lymph nodes removed, you're always at a risk of developing lymphedema. Now, if we look at a sentinel lymph node biopsy or someone who's just had a couple lymph nodes removed compared to an axillary lymph node dissection where someone's had a lot of lymph nodes removed, the risk is lower of developing lymphedema if someone's just had a couple compared to a lot. It is estimated that if someone's had 5 lymph nodes or less removed, that their risk of developing lymphedema is 5% or less in their lifetime. Whereas if someone's had an axillary lymph node dissection or a lot of lymph nodes removed, say like 20, their risk does increase to 20% or even more. Now, the highest risk factor for developing lymphedema is the lymph node removal. There are other factors that play a role. If someone has radiation, that does add another layer of risk to it. Again, that risk goes higher with someone who's had an axillary lymph node dissection versus a sentinel lymph node biopsy or a couple removed, but there is still a heightened risk. Other factors that play a role are things like obesity, genetics, or even just personal anatomy factors. These factors just play into a lot of uncertainty. Someone can have 20 lymph nodes removed and never develop lymphedema, while someone else only has 3 lymph nodes removed and does develop lymphedema. It can be a little bit confusing, but in general, overall, to answer the question, there is always a risk if someone has lymph nodes removed. It does just go higher with the number of lymph nodes you've had removed. And the last myth or statement that we're going to talk about today is, I had lymph nodes removed 3 years ago. Am I no longer at risk of developing lymphedema? Whether someone's at 3 years post, 5 years post, or even 20 years out from their lymph nodes removed or their surgery, they're still at a risk. Yes, that biggest risk is that first year or two after lymph node removal or after surgery, but someone can develop lymphedema years later. We don't see this very often, but it does happen. Like I just spoke about in the last question, if someone's had 5 lymph nodes removed or less, their risk of developing lymphedema is 5%, or if someone's had an axillary lymph node dissection and a lot removed, their risk can go 20% or higher. These are lifetime risks, so it can happen at any time. Typically what we see though is that if someone develops lymphedema, there is some sort of correlation or causation with something like an infection or cellulitis, or something that exacerbates or triggers the lymphedema. Other factors that can trigger or cause a flare-up of lymphedema are things like a major injury or a fracture, or also morbid obesity. We spoke about this in another video. Weight and obesity does have a correlation with lymphedema risk, and so that's something to be aware of, and you can check out the other video to learn more about that. So those are the 3 myths that we're talking about today. If you want to hear about any others, be sure to comment those down below, and I will see you all next week for another video. Thanks everyone.